So we can go ahead and we can mute our mics. And then, of course, if you have a question, you can always turn your microphones on and ask me. So first of all, let me welcome you all. And let me, first of all, congratulate you all on passing your INBDE exam. Now, most people always say, why do I congratulate you before you even take the exam, right? Because I know you're going to pass the exam because that's why you're in this class. And we do not have anybody in our classes who don't pass. So that's the first thing. So congratulations on that. So what we're going to look at tonight is basically how the class is going to go, how we're going to run the class. We're going to go through some different things. And at the end, if you have any questions, feel free to ask me, okay? Now, from time to time, I will be asking, do you understand? Does that make sense? Just click your microphone on, say yes, just let me know you understand, okay? All right, here we go. So I'm going to share my screen with you. Now, once I share my screen, I won't be able to see you all anymore. So I will need you definitely to respond and let me know you can see it. Okay, here we go. All right, can you all see my screen okay?
Yes, doctor.
All right, perfect. All right, so let's go through and talk about what we're going to do for the next few months. So the things that you're going to need in order to pass the INBDE, and keep in mind, what did I say? Pass the INBDE. The very first thing that I want you to do, your very first homework assignment is this. I want you to take 3 pieces of paper, and I want you to put those 3 pieces of paper in places that you frequently visit, whether it's the kitchen, whether it's the bathroom, or whether it's the bedroom, and one on your person. And on that piece of paper, I want you to write in big letters this: pass INBDE. I want you to look at this every single day, every day. I want you to see it. I want you to believe it. I want you to know you're going to pass this exam, okay? Now, what do you need in order to pass that? Well, we're going to talk about the resources that you're going to be using, the books, the notes, the different things that you're going to be using. We'll go over the meeting times. I'll show you the class calendar, how to study. Wow, this is a big one. How to study. We're going to have a particular section on just how to prepare for the exam and how to study for it, okay? There are going to be some pre-class assignments, which I'll show you in just a second. Everybody should have already signed up or logged into the WhatsApp group. Is that correct?
Yes, doctor.
Okay, perfect. So yeah, so definitely you want to go ahead and log into that WhatsApp group because that'll be a good place to share information. If there's something that comes up, we'll put it in the WhatsApp group. So make sure you sign into that WhatsApp group, okay? And then finally, we'll go over the contact. So let's jump right into it. So what are the resources? So we're going to be using, now, a lot of people say, oh, I hate the Mosby book. Why are we using the book? You're not really using the Mosby book. You're only using the Mosby book for content review. Okay, so we're going to have a set of notes, things that you're going to follow. And then the things that we go over, we want you to look at the Mosby book to see and make sure that everything we talked about, you see it and go through it in the Mosby. Does everybody understand that?
Yes, doctor.
Okay, perfect. All right, the second thing is your class marker, all right? The class marker. So this is where you're going to be taking your quizzes. So after everything that we complete, every time we complete a topic, you're going to do a quiz related to that topic. These quizzes help us to understand if you really know the information or not, okay? These quizzes also have a lot of questions that you may see that appear on the actual exam. Now, the key thing is, remember this, every time we do a topic, when we finish that week of information, that Monday and Wednesday, before we meet the following week, we want you to complete that quiz, okay? So do not get behind on the quizzes, all right? The next thing is the PowerPoints. All of the PowerPoints and lectures will be inside your calendar, okay? And I'll show you that in just a second. 3 months before your exam, you will have access to the Dental Mastery app. Now, we want you to go through the Dental Mastery app twice, okay? We want you to complete it 2 times. The first time you go through it, we want you to do it just to basically understand the content, understand questions. The second time you go through it, we want you to be able to teach it. One of the things you're going to learn and you're going to hear from me quite often is the way that I know you understand information is if you can teach the information. So always remember, if you can't teach it, you don't know it. So make sure whenever I ask you a question, do you understand? If you say yes, what does that mean, Dr. Lazo?
That means you are able to teach the subject.
Perfect. Absolutely. Great. Perfect. All right. All of our classes are going to be live interactive classes, just like you're seeing right now. Okay. And at the very end of the class, we're going to have a high yield review. And that's just to cover the most recent topics that have been on the INBDE exam. That's at the very end of our 3.5 months. Okay. All right. Class times and days. So we are going to be meeting Monday and Wednesday at 7 p.m. Central. Okay. Now, typically the classes are about an hour and a half, but no more than 2 hours. Every now and then, we will add some additional classes depending on how much we cover. So if there's something that came up that we definitely need to cover, we may add a class day. But that will be in your calendar and you will know ahead of time if there's a day that we're adding other than a Monday or a Wednesday. It will never be a weekend. It will only be during the week, okay? But our classes are on Mondays and Wednesdays. Okay, so the class calendar is our Google Calendar, which we'll look at that in just a second. Now, this is the big part, how to study. All right, so the very first thing that you're going to do is you're going to review the content before class starts. So you're going to go to your class calendar, click the PowerPoint, review that information in your Mosby book, but make sure you review the PowerPoint. Second thing, you're going to attend the class. Now, when you come to class, this class is very interactive. So when you study the PowerPoints, for instance, on Wednesday, we're going to be looking at opioids, right? For pharmacology, we're going to be looking at opioid drugs. So as you go through the PowerPoint, I want you to be able to ask some questions, right? Because when you come to class, if you have no questions at all, that means you really understood the PowerPoint and you need no help. And we don't believe that. So always come to class prepared to ask questions on things you may not understand. Does everybody understand that?
Yes, sir.
Okay. All right. Perfect. Now, after class, you're going to review the recordings. So every class that we have, we record these classes. Now, just in case you miss a class or you miss part of a class, you'll be able to go back, and I'll show you where in just a second. You'll be able to go back and look at that class, okay? Now, after you've done all of that, you actually complete the quiz related to the topic that you covered. That is the method on how you study, okay? It's called review, attend, review, complete. Everybody got that?
Yes, doctor.
All right, perfect. Great job. All right. On your class marker, which I'll show you in just a second, we want you to complete what we call a pre-class assessment. We want to just see where you are right now, how much you understand at this moment, okay? I know some of you have done it, some of you haven't, but we'll make sure that Elaine sends you the link and your login and password so you'll be able to access that. The assessment is about four hours. I think it's about maybe, I don't know, I think it's like 400 questions, if I'm not mistaken. But it'll let us know exactly where you are right now, okay? All right, this is the WhatsApp group. So a couple things about the WhatsApp. This WhatsApp group is only to share content with your classmates. So for instance, let's say, for instance, you see something that were remembered questions or somebody posted some remembered questions on Facebook and you want to share with the group, you can post it here in the WhatsApp group, okay? The WhatsApp is only for positive comments. Please do not put anything negative in the WhatsApp group, because your classmates, you know, your fellow dentists, you all want a good, positive environment. If there's something that as administrative or you need help with, please email Elaine and she will definitely get the information to you, or she'll send the information to me and I'll get it back to you, okay? All right, big things here. So this right here is our office number, okay? This is my direct contact number, okay? So if there's something that, you know, that may be an emergency where you need to really talk to me, you can reach me directly on my contact number. You can send me a text. I'll call. Normally, I'll get back with you within 24 hours, okay? This is the company email. So for any administrative questions, you can always email Elaine, okay? Everybody got that? I'm assuming yes. Okay.
Got it, Doctor.
Got it. All right. I love that. Perfect. So let's jump right into some of the things that you need that are important. Okay. So this right here that you're looking at, this is your class marker. This is what you're going to have a login and password to. When you log in, you're going to see a tab that says INBDE class update. This is where you will find all of your quizzes related to the class. So oral pathology, dental anatomy inclusions, anesthetics. So every time you complete a topic for that week, you'll go through and you'll complete the quiz. And let me show you what, give you an example. So let's say, for instance, we did bisphosphonates. Well, let's go look at opioids. So we're doing opioids on Wednesday. So when you do the opioids, you'll look at that and you'll see that there are, let me see how many questions. There are 15 questions. They're pretty quick, pretty simple. The passing score is 75%. And whenever you complete that opioids quiz, what we're going to do with that is we'll be able to go back, and let me show you what we're looking at. We're going to be looking at your score compared to the class average, okay? And let me show you what I mean. So if you look right here, the class average, and when I say class, this is based on all the dentists who have taken this particular test in our group since we started. So you can see there are a lot of dentists who have been in the group, and everything that's in red means it didn't hit the 75% mark, okay? If you get green, then you're above the 75%. So we're going to be looking at your score compared to the class averages, okay? That will let us know if you really understood the information. Any questions on that? Any questions on that? Everybody good with that?
Yeah, we
Yes, Doctor. There's someone who's trying to get in, Doctor.
Oh, okay. Thank you for telling me that. I didn't know. All right, perfect. Hold on, let me see. Stop presenting. I don't. Okay, hold on. Let's see. I see Dr. Andrea says something that I haven't. I don't know what. Okay. See, I'm not able to see the text when I'm presenting, but I don't see anybody trying to log in right now. Okay. Yep, I don't see them right now. But let me know if they pop back up, okay? All right. Oh, okay. The mic isn't working. Okay, got Dr. Andrew said the mic isn't working. Okay, gotcha. All right. Okay, so I will definitely say this. We need to make sure we work on trying to get the mics working, because the mics are very important, especially if you want to ask questions. So whenever the instructor is presenting, they cannot see you and they cannot see the chat boxes, but they can hear you. So if you have a question, if you can turn your mic on, you can always ask the question. Now, for those who are able to see the chat boxes, because the instructor can't, so for instance, if Dr. Lazo saw that Dr. Andrea posted a question, you can always say this is the question, and then if you don't have your mic working. Okay? Everybody got that?
Yes, doctor. Oh, there we
Okay.
go.
Okay. Perfect. I see it now. I see that Dr. Patricia was logging in. Okay. All right. So let's go to the next thing. Okay. So everybody's good with the understanding how to access the class marker. Elaine will send you your login and password for that. Okay. The assessment that I was talking about that everyone should take, let me show you where that's at. Whenever you go to your class marker, you'll see something that says, let's see where it is. It's called IMBDE. I think it's probably the practice test, but you'll see it. It's an assessment. And this assessment 2 is approximately, I think it's 200 questions. So you'll just complete that. And again, 75% is the passing score. All right, now for the fun stuff, okay? The other thing that you want to know is your calendar, okay? So this right here is your actual class calendar. And you all, I guess, because you're in class, you were able to access the calendar. And when you go to your class calendar, I want to show you something. So if you look at Wednesday, you can already see that there's a link for antibiotics and intro to pharm. So these are the things that you want to complete and review before class. Please listen. Make sure you complete this before you come to class on Wednesday, okay? Because it's going to be interactive and I'm going to be asking you questions. Everybody got that? Everybody with me?
Yes. Yes,
Okay.
doctor.
Yes,
Perfect.
doctor. And I have a
Yes.
we have to do assignment before the class or after the class?
Before. So
Before the class. Okay.
not the quiz though. The quiz you want to complete after you've done the class and you've reviewed the information.
Okay. Thank you.
Okay, perfect. All right. So let's go through and I want to show you kind of like a sample of what we're going to be doing in class. So let's go here. All right. So let's just say a typical class will go like this. So let's say we're going to be covering opioids. All right. Whenever we're covering opioids, we're going to talk about, okay, since you've already reviewed the material, we'll talk about, okay, what are the natural occurring opioids, right? So if I ask Dr. Lazo, what is the actual purpose of an opioid? Why do you even give a patient an opioid?
I don't really remember. To make them feel better when they're in pain.
Say that again. Because of what?
They're in pain.
Been doing pain. Okay, gotcha. So you say opioids are for pain relief, right? So basically what we'll talk about is, okay, the test questions. What are the naturally occurring opioids like morphine, codeine, right? These are naturally occurring. There's an actual IMBDE test question that asks you the difference between which of the following is a semi-synthetic opioid. So they list the different opioids and they say which of the following is a semi-synthetic opioid. That is an actual test question that has appeared several times on the IMBDE. Now, when we look at opioids, we're always going to say the key thing to remember is this. If they ask you about which receptor does an opioid bind to, there are kappa receptors, delta receptors, sigma, but guess what? The answer for the test is going to be mu. Opioids, they bind to the mu receptor and they typically have their analgesic effect by binding to that mu receptor. Does everybody understand that?
Yes.
Okay, perfect. Gotcha. Now watch this. The next thing, whenever we look at an opioid, you have what we call our opioid agonist. That's like your morphine, your codeine, methadone. All of those are agonists. I can't see the names of everybody here, but once the class is started, I'll know everybody's name and I'll be asking questions, okay? So if I were to ask you, what is an antagonist? Not Dr. Lazo, anyone. What is an antagonist? Anyone know what an antagonist is?
Antagonist when the drug is block the effect of another drug.
Okay, very close. So an antagonist is going to block the effects of the agonist.
Yeah, of the agonist, yeah.
Correct. For instance, so if morphine is what we're looking for, let's say, for instance, a patient is in pain and you give them morphine, right? If you give them morphine and they overdose on morphine, or they're overdosing on morphine, you want to give them an antagonist. Does that make sense?
Yes, yeah.
Now, you don't want them to overdose. If I say, do you want to give them too much opioids? You say, nah. So if I say, do you want them to overdose on opioids? You're going to say what? Nah, which is no. Everybody follow me? So how do you remember your antagonist for opioids? They all start with what?
Nah.
NA. Do you see that?
Yeah.
Pretty easy, right?
Yeah.
That's right. So anytime you see a question on the test and they said that a person has like pinpoint pupils, things like that, you know that they've overdosed on opioids, and they ask you which of the following should be done next, then you want to give them an antagonist, which is NA, N-A, okay? Now, watch this. On the exam for pharmacology, this is probably one of the most important things to remember. With pharmacology, they're always going to ask you, how does the drug work? What is the mechanism of action? So for opioids, now watch this. Have you all heard of this word before, neurotransmitters? You all heard of that before?
Mm-hmm.
Perfect. So you have neurotransmitters that can excite the brain, and you have neurotransmitters that can depress the brain or depress activity. So the excitatory neurotransmitters are things like glutamate, epinephrine, norepinephrine, right? Acetylcholine. All right, everybody see that?
Yes.
The inhibitory neurotransmitters are things like glycine and GABA. Now, all right, so I want you to remember this easy to remember mnemonic. It's spelled NAG, N-A-G, NAG. Now, a NAG, now don't take this personal. I don't want you to judge me, but I use this mnemonic to remember, like if I'm watching the football game and my wife wants me to do something, but I'm watching the football game and she keeps asking me to do it, even though I'm watching the football game. She is starting to what? Nag me. Does everybody understand that? Now, what does that mean? That means she is excited about something and she wants me to see it. So the way you remember your excitatory neurotransmitters is the word NAG. Norepinephrine, acetylcholine, and glutamate. Everybody got that?
Yeah.
So you'll never forget that, will you?
Yeah.
No.
Good. Now, guess what? If you have an excitatory neurotransmitter, do you think the brain is going to be excited? And do you think you're going to feel pain if you have an excitatory neurotransmitter?
No pain.
No, think about it.
Huh.
It's excitatory. It's not. So think about this. Think about it this way. If you say, if my hand is inhibited and the pain receptors are blocked, am I going to feel pain?
Yes.
If my pain receptors are blocked?
No.
No, I'm not going to feel pain, am I? So think about this for a second again. So imagine this for a second. Watch this. This is pretty cool. Watch this. Let's say, for instance, I'm going to draw this little box right here. So let's say this right here is a pain receptor. You see that pain receptor? If I have, let's say, epinephrine, is epinephrine excitatory or inhibitory?
Excitatory.
Excitatory. Perfect. Excitatory. Great. If epinephrine is binding to this area, if epinephrine is binding to an area, am I going to feel pain?
Yes.
Yes.
I am, because it's excitatory, right?
Mm-hmm.
Right. Now watch this. If I don't want to feel pain, which neurotransmitters do I want?
Either glycine or GABA.
Perfect. I want one of these, right?
Mm-hmm.
Because these are what? Inhibitory. So the one for opioids, don't forget this. If they ever mention opioids on the test and they ask about mechanism of action, look for an answer that's talking about GABA. You understand that?
Mm-hmm.
Okay. Everybody understand that?
Yes.
Good. Can you teach it?
Yes.
Okay. That's what I want to hear. You should be able to teach it. Okay. Quick review. Quick question. What is the most common receptor that opioids bind to?
Mu receptor.
Perfect. Good. What is the name the two inhibitory neurotransmitters?
GABA
Yes,
and another G.
that's right. What's the other one? GABA and glycine.
Glycine.
Okay, perfect. GABA and glycine. Everybody got that? All right. Now, let me just tell you something that's pretty cool. I want you to watch this. This little circle is a cell. Okay, here's a cell. Anytime the inside of the cell becomes positive, we call that depolarization. Okay, this is going to be important for pharmacology to understand this. If the inside of the cell becomes positive, what do we call that?
Depolarization.
Perfect. That just means that the cell has gotten excited. Okay. So if you want to excite the cell, bring some positives inside the cell. Now, if the inside of the cell is more negative, we call that repolarization. Okay, got that?
Mm-hmm.
Now, there are two things I want you to remember. Sodium has a positive charge. Calcium has a positive charge. Potassium has a positive charge. Okay, now watch this. Normally, sodium is really high on the outside of the cell. Whenever the cell gets excited, sodium starts to come inside the cell. What's going to happen to the inside of the cell? It's going to become more what?
Depolarization.
Correct. So what's going to happen? More positive or more negative?
Positive.
Perfect. Outstanding. Perfect. Now, why is that important? If the inside of the cell becomes more positive, that means you are going to feel pain in this case. Does everybody understand that?
Mm-hmm.
So one of the things that you can say is, in order to block pain, then you don't want to depolarize the cell. Does that make sense?
Mm-hmm.
Okay, perfect. See, this is easy, right? Now, you may say, watch this. I know you're saying, but Dr. Sutton, we weren't going over opioids tonight, but no. The whole point of doing this was to show you how we teach the class, okay? So does everybody understand how we're going to be teaching the class?
Yes, doctor.
Okay, perfect. Now, typically at the end of most of the classes, we're going to do something, and let me show you what that is. Let's see, let me bring this up. Let's go here. Every class that we record, everything that you attend, we're going to put that in what we call your Google Classroom, okay? This let me show you, all right. You should have gotten a link in your email to join the Google Classroom. This will be your classroom. Anytime you have a recording, you can just go over here to classwork, and whatever recording that you've had, it'll be in your classroom. Does everybody understand that?
Mm-hmm.
Okay, good, perfect. All right, so the final thing I guess you need to know is what we do and how we answer questions.